We're going to take a look at the lateral side of the knee. We're going to look at the iliotibial tract, the LCL, and also the biceps tendon. To do this, we're going to scan first the iliotibial tract, which is in this direction, and then right parallel to it, distally, is the biceps tendon. So if you look at the where the biceps tendon goes, it's in this direction, and here you see the tract that goes. They go in the same direction. They're parallel to each other, and right in between those two, from proximal to distal, you have a more oblique orientation of the LCL. So it goes here from the femur. It goes a bit dorsally towards the fibular head right there. Yeah. So, and we call it sometimes a Zorro maneuver. In this case, it's a reverse set because it's a right knee, but it doesn't matter. We start first here on the iliotibial tract. Sometimes you can palpate it. With him, you feel a nice cord-like structure. Then we put it on there, and we see the image. Yeah. So we see the vastus lateralis right here. Here we already see a quite nice collagen dense structure, which is the band. We're going to follow this band distally, distally, distally. Here we see the band cross over the lateral epicondyle right there, and in between there we see a little bit of tissue, which can be the fatty tissue in between. We follow the there we go. We follow the tract more distally first. We follow the tract more distally. You see here very nicely, very clear the bottom line of it. And this here is the gluteus tubercle. You see the bottom line stopping here, and the superficial line. We see it here, and it continues a bit further, further, further. And it can go quite far. Here it stops around there. Yeah. So the insertion is from here until there. Here in the deep part here, we can see also the meniscus. If you angle it this way, it becomes full of anisotropy. If I angle it a bit in another way, you can see some reflections of the meniscus. Sometimes here you can see osteophytes. In this case, there are no osteophytes. It's a normal bone line. If you have osteophytes, you have very pointy edges of the bone right there. Okay, so we go back. From this position, we go a bit more back proximal to the place where the iliotibial tract crosses over the lateral epicondyle. And from this position, if you look at my hands, you can see we have to go a little bit dorsal. So first we go from here, we go a little bit toward dorsal, and then we will see a change in the bone. What we will see here is the popliteal groove with the popliteal tendon right there. It's a bit obliquely scanned, so it looks a bit strange. If I go back to the front, there we have the iliotibial tract again, so we go dorsal again, and then we get this nice view of the popliteal groove. This popliteal groove, you put it a bit to the side of your image, so this is proximal right now, so we put it a bit more proximal to the side of the screen, like this, and then with our distal end, we're going to start angulating, to the distal part of the probe, we're going to start angulating it towards the fibular head, and we'll do that right now. And if we do it correctly, and it's a hard scan, it's a tough scan, we can start to see very nicely here. Let me point at it. This is the lateral collateral ligament right here. So we're going to try and follow it up. You see it continuing here, here, here. Here it seems to make a bit of a corner. It's a bit like there's a dent in it. And that's because just above it here is the biceps tendon. The biceps tendon here is crossing over the lateral collateral ligament and causes this bundle to be a bit with an angulation. So if we follow it a bit further, we can see it insert here in the bone. It's not very clear with him in this case, but here this is the biceps, this is the lateral collateral ligament, and here in the deep part is also a little piece of the biceps tendon. We don't see it very clearly now, but that's the, we call it a bifurcated biceps tendon, where it bifurcates around the collateral ligament. So this is the ligament, and this is the two bundles of the distal biceps. So that's the lateral collateral ligament. So from this position, now the only thing we need to do, we fix this point of the probe because we're already on the fibula, and we're going to angulate this probe until we're in the same line as we were before with the iliotibial tract. So let's see if we can do that, like this. And then it's a bit hard in this position, but let me try with one hand. Here we see a very nice biceps tendon, very thick tendon, and we go a bit proximal. Here we see the muscle belly underneath. We go a bit further up, and the tendon becomes thinner and thinner and actually becomes the aponeurosis. If we go distal again, whoa, distal again, we see the biceps tendon insert. You don't see a very clear insertion. We don't see the bundles. It seems like the bundles are kind of stopping here, but that's also because here, remember, there's a structure crossing through the tendon. That's the LCL. So it makes it a bit of a difficult image. A lot of people see this as a possible tendinopathy, but this is a normal image. If you have any doubts, compare to the other side and you will see that it's exactly the same.